Hi everyone, I'm Steven, nurse practitioner here at Wave, and today I want to share some of the things on how I look youthful at 40. So I'm not doing anything crazy, I'm not spending hours in the restroom, and I don't have a 20-step routine. I like to keep things simple, consistent, and effective. So if you guys are looking for an improvement in your appearance but don't know where to start, this video is for you. Let's start with the basics. First thing, I sleep. I enjoy sleeping and I try to get about 8 hours every night. Basically, looking young starts with recovery. So when you sleep, your skin repairs itself, your hormones rebalance, and your inflammation goes down. Your face literally depuffs and tightens. So if you're living on 4 to 5 hours of sleep a night, no skincare or treatment can save you. So get the right sleep and your baseline improves instantly. Second, I don't smoke and I rarely drink, knowing that smoking destroys collagen. Alcohol also dehydrates your skin, messes with your sleep, and causes chronic inflammation. These are the kinds of habits that age your face from the inside out, even if you're using the best products on the outside. So if you're looking to look younger, cutting back on drinking alone can make you look noticeably fresher, even in a few weeks. Third, I work out about 4 or 5 times a week. Why? Because training keeps your muscle tone, improves circulation, reduces stress, and boosts testosterone, among other things. And that testosterone is not just about energy. It literally influences how tight your skin looks, how defined jawline is, and how fast you age. So you don't need to be a bodybuilder, but you just need to move, lift, sweat, and your face will thank you. Now let's talk about skincare. I only do 3 major things after washing my face. Step 1, I like to use some type of toner that resets my skin's pH and helps everything absorb better. Think of it as prepping the canvas. Step 2, I like to add on a little bit of moisturizer, but this is where you choose your function. Some days it's used for hydration, if I'm feeling dry or if it's winter season, like a simple moisturizer. Other days I might use like an anti-aging ingredient like peptides or retinol, depending on what my skin needs. And then step 3, sunblock, the non-negotiable. Sunscreen is the most important thing that you're not doing. UV breaks down collagen, it creates texture, wrinkles, dark spots, and sagging. And if you want to look young, sunblock is not optional. It's definitely protection for your collagen investment. All right, let's talk treatments. And I like neuromodulators because it's simple, quick, and it keeps you looking rested without changing the way you look. Because most guys don't really want to look done. They just don't want to look tired or stressed or older than they feel. That's exactly what neuromodulator helps with. And here's a little tip. If you have an important event, an interview, a reunion, or a party to go to, do your Botox 2 weeks ahead. That's when it hits peak effect and looks the most natural. But there are a few things you can't do before and after Botox, and we have an entire video that explains all the rules that you could check out right here. Now we have VI chemical peel, which is for skin clarity, glow, and overall resurfacing. Why do men benefit from it? Because we tend to ignore skincare for years and then want quick results. So VI chemical peel helps with, sun damage, texture, dullness, and we actually have a full video explaining what to expect step by step. You can watch that here as well. So lastly, we have Morpheus 8, and here's why. After age 25, we all start losing collagen every year. It's a slow process, but it does add up. So Morpheus 8 works deeper than lasers and microneedling alone. It stimulates collagen, tightens your skin, and softens acne scars. I had a lot of acne scars along my temples, and after the treatment, I did notice it kind of softened and smoothed out a little bit. So for maintenance, it's one of my go-to treatments, and if you want a full breakdown, pain level, results, timeline, expectations, and stuff like that, that video is also linked right up here. These are some of the treatments that I recommend to all of my male patients because of the amazing results and the feedback that I get. We have number 1, alt therapy, which is good for tightening without any downtime. Alt therapy is one of the most underrated treatments for men, especially guys in their late 30s to 50s who want to stay sharp without doing anything obvious. Alt therapy uses ultrasound energy to reach the SMAS layer of the skin, which is the same layer surgeons target during a facelift, but it tightens it without surgery, without injections, and without downtime. And a lot of my male patients love this because no one can tell that they did anything. They just look more lifted, more structured. The next one, BHRT, bioidentical hormone replacement therapy. Some of the biggest transformations I've seen at Wave didn't start with skincare, they actually started with internal health. I've had patients come to me feeling tired, sleeping horribly, having low libido, feeling a little down, depressed, and not just like their normal selves. So BHRT helps rebalance your hormones back to a healthier range. And when that happens, your skin improves, your metabolism improves, your confidence improves. And our medical doctor, Dr. Peter Lee, actually has a full video breaking down how BHRT works, who it's for, and what results to expect. So definitely check it out if you're curious. The last one I'll mention is peptide injections. For men who want to support their performance, sleep, metabolism, and skin, peptides can be incredibly helpful. So different peptides can help with, for example, better sleep quality, muscle recovery, improved energy, collagen stimulation. It's just another example of internal health working hand in hand with appearance. And Dr. Peter Lee also made a full video talking about how peptides work, so definitely check that one out as well. These are the treatments I do and the treatments I recommend based on the results that I see every single day with my patients. So the key is start somewhere, start simple, and stay consistent. You don't need to overhaul your life overnight, but pick one thing from this video and start with that. If you want to see more men's anti-aging content or treatment breakdowns, let me know in the comments. I'm Steven, and I'll see you in the next video.